Hi, my name is Jessica Payne, and I decided to do my brochure on CIC, which is Clean Intermittent Catheterization. This brochure is both for family, so they know what the procedure looks like, how to prepare their child, and it's also for you to know what's going to happen at school, since it is a health-related service that a nurse or specialized personnel can perform. So what I included in here was why you should choose CIC. So if you're unable to urinate, if there's a buildup of pressure in your bladder, or if you're leaking, CIC might be for you. It limits infections, buildup of scar tissue, constant recurring UTIs. So those are things to consider when considering CIC. Now, if you are going to go through with CIC, finding the right catheter is important. So I have a chart here, and it tells you, from newborn all the way to adolescence and what kind of sizes will work for your child. I also included preparing your child, because it's important to talk to your child, hey, what's going to happen, what the procedure is going to look like, all those things. So I included, talk to them about the urinary tract system. So I included pictures of a female and male urinary tract system, so they kind of see, hey, what's going to be happening, even for parents who may be unaware, just exactly where's the catheter going to be going. So that's also important to know. Explain to them how it's important to pee, how your body needs to release, pee, and just explaining that whole, again, urinary tract system and how it works. Also showing them the various supplies, which I've listed in procedure at school or at home. And then tell them, again, that it's not painful, but it may be uncomfortable, so they know it's kind of what to expect, and that it's not going to be all hunky-dory and roses and all that kind of stuff. And then also provide positive reinforcement. So, oh, you did a great job, you're doing so well. After this, we can go get a piece of candy, or we can go get a cookie, or you could set up a star chart to where if they receive 5 stars for that day, go take them to Dollar General or something like that. So, just to begin with, I think setting up a reward system and creating positive reinforcement is great. And then prepare your child again and again before procedure. So procedure at school or at home, this is kind of, just either or, right? So you want to make sure your supplies are in order, which includes a catheter, lubricant. You do not want to use Vaseline. You want to use KY jelly, or I think it's called Muco. And then you want to make sure you have soap and water to clean the area before you do a catheterization. Make sure it's all clean and dry. You want to have washcloths, wipes, container for the urine, or you can position them over a toilet bowl and put one end of the catheter in there. A hand mirror in case, they want to know what's going on, especially a female. Again, I think it said 5 years old and up, they can kind of help assist and do it themselves. Procedure will be explained to your child by the school nurse, and if able, they will assist. Again, you want to clean areas. Your child will be positioned appropriately. Now, for females, they will be seated on the toilet or positioned on her back with feet flat on cot. For males, they will be positioned over a toilet or standing up over a container. The tip of the catheter will then be lubricated. So you want a little bit of lubrication, not a lot. And then for females, labia will be gently pulled back, and you'll find the urethral, which will be visualized. For males, if not circumcised, the foreskin will be pulled back and then inserted. Now, you want to do this procedure at least 4 to 6 times a day. I also included, teachers will help assist, but again, a school nurse or specialized personnel will be doing the procedure. There'll be documentation on volume amount of urine, if there's any sort of abnormalities like odor, color, clarity, and then your catheter will be rinsed with soap and water and placed back in container, which the container will be labeled dirty. So you need to have a bag or container labeled dirty and clean. So that leads me to the care of the catheter, which I also include that. You want to clean catheters after every use with warm soap and water. And then you want to place that catheter into a bag labeled dirty, okay? Now, after the end of each day or whenever you are prepared to sterilize, you're going to be sterilizing once a day. And you can either boil hot water and stick all your catheters in there, or you can soak them in vinegar for 30 minutes. There's 2 ways of sterilizing, whatever works best for you. Go ahead and do it. And then you're going to let them dry and then store them in a safe place or a container, again, a bag that's labeled clean, because you have cleaned them. I also included family resources. So there's several different resources that I included, which is parents' guides, support groups, catheter supply website, step-by-step guide, which I did a Spanish step-by-step visual guide, and then alternate treatments, which I also included. So yes, so I decided to do that for my brochure. So thank you.